One of the data resources on the HealthWell are the Public Health Information System tables. These PHIS tables can be accessed from any point on the site via the top data drop-down menu. PHIS is a series of health-related data tables compiled by the Department of Health and Children in the Republic of Ireland. They can be analysed and manipulated to give you the information you want. At present, there are 24 data tables spread across 6 themes: cancer, demography, fertility, hospital admissions, mortality, and psychiatric inpatients. These tables are updated each time the Department of Health and Children releases new data. One of the tables available is the National Cancer Registry Summary Dataset. When you click on the link, the table is opened using the HealthWell's online data tools. The data page will open in a new tab. At first, you will be presented with a basic page detailing certain statistics of all cancers in Ireland between 1994 and 2009. You can look at the total number of cases, the crude incidence, and the European Age Standardised Rate, or EASR. At the top of this page, you will find details about the data table, such as definitions, sources, and some advice about how to use the data. Below this, the page is divided into 2 parts. On the left-hand side, we have the Selection panel, which allows you to choose the data you want. Attributes are characteristics of a population, such as age, gender, or social class. In many datasets, such as this one, they also include year and location. Indicators are numeric values, such as counts, rates, ratios, and percentages. Hovering over the I or the question mark with your mouse will display additional information about the attributes and indicators. On the right-hand side of the page is the Results panel, where the data you have selected initially appears as a table. You also have the option to create a graph or map. If at any point during your work you wish to add or remove certain results, your Results panel will be automatically updated. Suppose, for example, we wish to examine the total incidence of stomach cancer each year from 2007 to 2009. First, we choose our attributes, in this case, the years we're looking for. Once we have done this, we click Save. Then we must choose the site of cancer. Then we will choose the indicators we're looking for. And again, we will click Save. There are also tools for exploring larger or more complex data tables. A variety of charts and maps can be generated from any information selected and displayed in the tables. If at any point you change your selections on the left, the table or the chart will automatically update and display the new data. So, suppose we wish to compare male and female rates for stomach cancer between 2004 and 2009. To do this, we will generate a line chart with separate lines for males and females. So, we select crude incidence rate as our indicators, and the years 2004 to 2009 from attributes. Because we want separate lines for males and females, we deselect the male and female option from the sex attribute and select male and female separately instead. Finally, we select C16 stomach cancer. The data table in the results panel will be updated after we save the new selections. We view this as a chart by clicking on the View Results As and selecting Chart. Then we select Line as the chart type and fill in the chart parameters as before, except that we need to specify sex as the extra attribute because we want separate lines for males and females. As before, you need to select the values of the other attributes on the data table before the map or chart can be displayed. Lastly, clicking on Chart options allows you to rename the table, chart or map and download it to your desktop. Maps are useful for comparing regions. The maps are generated based on the information selected and displayed as the results table. In this instance, we want to look at the crude incidence rate of stomach cancer across all areas in the Republic. The areas that appear on the map are those that have been selected from the Attributes panel. So, to produce this map, we went back and changed our selections. So in this case, we must modify the area selected. Rather than selecting the Republic of Ireland, we must select each county. Finally, if you wish to return to the Healthwell website, then simply click on this link and you'll be brought back to the original PHIS page.